Hello everyone, this is Marika and I welcome you all to this new session of Nursing Management with me. So in our previous sessions, we have discussed about the patient classification system, different types of patient classification system, and we also discussed about nursing care delivery system, in which we have already discussed about the first type of care delivery system, which is case method. In this session today, we are going to discuss the second type of nursing care delivery system that is followed, which is called as functional method. Today in this session we are going to discuss about what is a functional method and various advantages and disadvantages of functional method. We are already aware that a functional method is a type of nursing care delivery system, which means it is one of the way through which nursing care is delivered to the patient. And we also know that there are different methods that are followed in different organizations, and sometimes they may select a particular method to deliver the nursing care, and sometimes they may even combine and modify different types of methods in order to meet the unique needs of the patients. The functional method of nursing care delivery system evolved around World War II, and it happened because there were shortage of nurses during that period of time. Nurses were in great demand, and because there was shortage of nurses, other people who are not nurses were trained to provide the care to the patients. The non-professionals workers within the organization used to assist in providing the patient care. But of course, as I said, in the term itself, we can understand that there are professional nurses and non-professional worker. So the skills of the nurses and obviously a non-professional worker will be different. So this unskilled workers or unskilled people who were assisting in patient care were trained, and they were allowed to provide or to carry out simple tasks in terms of patient care. Even if they were non-professionals, they were carrying out the same task over and over again, and because of this repetition, they used to gain proficiency on the particular task. The non-professional workers here were not assigned the entire patient or were not given the responsibility of taking care of the patient as a whole, but they were only given certain tasks that they can carry out. For example, the non-professional workers were trained on how to administer oral medication or how to measure the BP of the patient, and therefore over a period of time, as they did the task again and again, they gained the proficiency over the particular task. The functional nursing or functional method of providing the nursing care emerged during the 1950s due to the shortage of nurses all around. Let us now see what is functional method of providing nursing care. Functional method is also called as task-oriented nursing or task-oriented method. And this particular method focuses on getting the greater amount of work done in a lesser amount of time. Now let us try to understand what exactly happens in functional nursing. In functional nursing, different staffs, different nurses will be assigned with the task or a procedure that they must carry out rather than assigning them with a patient. As I told in the beginning, as we have seen in the introduction, during the World War II, there were non-proficient workers. There were people who were not from the nursing field, and therefore they were given a single task that they have to carry out for different patients. And as they repeated the same task over and over again, they have gained proficiency. Similarly, like that, in this functional method usually focuses on giving the task or assigning the task or procedure to each of the nurses rather than assigning them with an individual patient or with a group of patients. So we have to understand that in functional method, the orientation or the focus is not the patient but the task. In this, the nurses are more focused on completing the task that is assigned to them rather than taking care of the patient holistically. So in functional method, a particular period of time is taken. For example, a week's time is taken, and all the people or all the employees working within the unit are assigned with specific responsibilities according to the skills that they possess. For example, if there are 3 different patients within the unit, the first nurse will only be responsible for providing oral medication. The second nurse will only be responsible for checking the vital signs of the patient, and the third nurse will be responsible for carrying out the daily routine activities. Similarly, like that, according to the skills that each of the nurse possesses and according to the need of the patient and number of of the staffs available in the hospital in the particular unit, different tasks were assigned to each and every staffs within the unit, and the staffs here do not focus on the patient care or providing a quality patient care, but rather completing their particular task. As I said in the example, there can be 3 different nurses, and 3 different nurses are assigned to perform different tasks. And similarly, like that, the same nurse was given the same work to be carried out for many different patients within the ward. For example, if I am a nurse working within the ward, if I am given a task of measuring the vital signs of the patient, then not just for one patient, I have to do the same task or the same activity for all the different patients within the unit. So here, as the nurse repeats the task over and over again, she gains proficiency and becomes skillful in the task that is assigned to her. I hope you've understood what functional nursing is. Moving on, let us see the definition of functional nursing. Again, this definition also explains the same thing here. There will be licensed member working within an organization, professional nurses working within a unit, and different nurses will be assigned a different procedure or a different activities that they should carry out for a large group of patients. Here, the nurses will be assigned with 1 or 2 tasks that they have to perform not just for one patient but for a large group of patients. They have to perform the same task for all the patients in the ward. One very important thing that we should understand here is that the tasks are carried out and according to the skill that each and every nurses will possess. If a nurse is skillful enough, she will be given a complex task to perform. But if there are new nurses who do not have enough training or who needs time to learn and can only perform simple tasks, such kind of nurses will be given simple tasks such as maybe administrating a medication or measuring the vital signs of the patients. Now let us see what are the responsibilities that are usually given to a particular category of nurses in functional method. Let us start with head nurses. We already know that the head nurse is a nurse in charge for the entire unit, and she is usually given the responsibility of direction and supervision of all the staffs working within the particular unit. She not only supervises the work of the employees in the particular unit, she is also involved for making rounds with the physician and also to see the quality of nursing care that is being rendered by the patient. So here we can understand that the head nurse have only 3 major responsibilities. First one is direction and supervision of all the staff nurses. The second one is going for nursing rounds along with the physician, and third one is to monitor the quality of nursing care. Here, the responsibility of the head nurse is clear and she is only supposed to carry out those activities. The second one that we have is a registered professional nurse. Now, under the head nurse, we have a registered professional nurse, and she will also be given a certain task that she should carry out for all the patients in the ward. She can be responsible for carrying out activities such as giving the medications to the patient, carrying out the physician's order, changing the dressing of the patient, etc. So these are the examples of few of the tasks that a registered professional nurse may carry out. The third one that we have is a technical nurse or technical nurses. Now here, technical nurses can be given the responsibility of monitoring the blood pressure or any other vital signs of the patient, and she can also be given the responsibility of monitoring the input and output chart of the patients in the ward. Another trained nurse may be given the responsibility of giving a bed bath to all the bedridden patients. So the responsibilities are assigned according to the category, according to the job title of the individual, and according to the skill that they possess. Now, nurse aides can be responsible for simple procedures such as bed making and assisting the mobility impaired patients to walk. And lastly, we have unit clerks, who is responsible for picking up the telephones, delivering the message, as well as maintaining the admission and discharge of the patients. So here we have to understand that functional method is one of the very useful method of delivering the nursing care, where there will be shortage of nurses, where there are less number of nurses. Instead of one nurse being focused totally on the patient, the nurses are assigned a particular responsibility and they carry out the responsibilities as it is assigned to them. But of course, another important thing for us to remember is that for the functional method to work properly, we should make sure that there's proper coordination and cooperation among the team members. Moving on, let us now see the advantages and disadvantages of functional method. Let us start with advantages. The very first advantage is that each nurse becomes very skillful, they become highly skillful, and they also become very quick in performing the assigned task, because we have already seen that a particular nurse will be only assigned to carry out few number of tasks, and she has to perform the same task over and over again for different patients, and so it helps her to become skillful to perform those tasks. The second important advantage is that the nurse becomes more independent. All the different nurses becomes more independent and less supervision is required. Obviously, if we become skillful in performing any task, if we are skillful in carrying out any of the activities, then it is easy for the person to also supervise. We will not require a lot of supervision because we are already skillful. Similarly, like that, in functional method, the nurses, as they perform the task over and over again, they become skillful and they will require less supervision and becomes more independent. The next important advantage is that this method proves out to be one of the economical nursing care delivery method. The next advantage is that the tasks that are performed are completed quickly. Obviously, the task will be carried out quickly, it will be completed quickly because there's not just one person performing the task. There are different people who are assigned and they know that they are accountable for performing the particular task, and therefore the task can be performed much quickly and completed quickly. Another important advantage of functional method is that it is useful in emergency situation. In emergency situation, functional methods can be used when there is shortage of nurses, when few number of nurses alone cannot take care of large group of patients. The functional method can be used so that the task is divided among the nurses and it is carried out skillfully by those nurses. So these are the several advantages, but everything comes with a disadvantage as well. The functional method of nursing also comes with several disadvantages. The first one being the care that is provided to the patient is fragmented. Obviously, as we have seen in the case method, the care that is provided to the patient is continuous, as one single nurse is responsible for meeting all the healthcare needs of the patient. But in functional method, the care is not provided continuously by one nurse, and therefore nurses are also focused on performing the task rather than taking care of the patient. And so the care that is provided by the nurses to the patients can be fragmented. Another disadvantage of functional method is that no nurse will be responsible for the patient care because they are not assigned with the patient, they are assigned with a particular task and they are only focused on completing the task. Therefore, the nurses will not be evaluating the patient care that is provided to them, and there will be no nurses who will be responsible for the patient care. The third disadvantage is that it is a function-centered method. As I have been telling, it is not patient-centered, it is not patient-oriented, it is task-oriented. And therefore, the focus of the staff is only to complete the task and not to provide a holistic care to the patients. Another disadvantage of functional method is that some aspect of patient care or some fragment of patient care may be omitted while giving the responsibilities or while assigning the task to be carried out to the nurses. For example, patient teaching. Now, we already know that patient teaching is very important, but here when we look at this scenario, we understand that patient teaching is not necessary for patients' well-being. So such kind of task which is actually required but is not a necessity may be omitted in this kind of nursing care delivery. Another disadvantage that we must keep on mind about functional method is, even though it will be quickly done, we have to understand that there will be poor patient and nurse communication because none of the nurses are responsible for providing the holistic care and none of the nurses are there to evaluate the patient care. Therefore, the bond or the rapport that is developed between the nurse and the patient will be poor because the nurse is not focused on maintaining the relationship, winning the trust or developing a rapport, but rather she is focused on completing the task. Therefore, we will see that there will be poor patient and nurse communication. The next one is monotony in the task. Now, as we know that the nurses will be carrying out the same task again and again and the work may feel monotonous. Another disadvantage of functional method is that the nurse will only become skillful in those particular tasks that she is assigned with, and she will become less skillful in other tasks that are to be performed. So as a nurse, we must be able to perform overall every task that is required for patient care. But in this situation, patient, the nurses may be only skilled in certain tasks which is assigned to them, and they do not get the opportunity to enhance the other skills. They will only be performing the same task over and over again, and therefore even if they become skillful, they will only be able to perform one or two tasks. Another disadvantage of the functional method of nursing care delivery is that the patient may become confused, as there are many care providers. Since there are many people who are coming and carrying out one or the other task for the patient may get confused and may not even be able to maintain any kind of relationship with the nurses. The very last disadvantage of functional method of nursing care delivery is that here we are neglecting the humanity of the patient and individual healthcare needs of the patient in an effort to just complete the task. For just completing the task or getting the work done, we are totally ignoring a holistic approach towards the patient care. And this is one of the major disadvantage of functional method of nursing care delivery system. So this brings us to the end of today's topic, which is functional method of nursing care delivery system, in which we have discussed what it is, when did it emerge, what was the reason for functional method to arise, and also various advantages and disadvantages of functional method. I hope the class was helpful, and I'll see you all in the next session. Thank you and have a great day ahead.